There are many eye drops on the market, and knowing which ones are appropriate for us can leave us with more questions than answers. My guest today definitely has the answers. I'm joined today by Dr. Mariah Zuckerman. She's an optometrist with Prisma Health. This is Flourish, a podcast brought to you by Prisma Health. I'm Scott Webb. Doctor, thanks so much for your time today. We're going to talk about eye drops, and I was just mentioning that folks have questions. We think we know what eye drops are for, what they do. We know probably not to use too many of them at one time, but it's great to have your expertise today. So let's just start here. Do eye drops help protect our vision?
So certain eye drops can help your vision. It just really kind of depends. So for example, drops that are for glaucoma can help protect your vision by slowing down the disease process. And there's other drops like dry eye drops that are really common and they can help protect like the front surface. So in those ways, there are eye drops that can help protect your vision.
Yeah, one of the things I usually turn to, and I don't have excessive allergies other than sort of seasonal allergies, but I have these allergy eye drops that I often use when my allergies are bad because my eyes start itching and then they get watery. So I tend to use those in the sort of allergy months, if you will. But what other eye problems can eye drops help with?
So allergies is a really good one. It's a very common one, I should say.
Sure.
And so is chronic dry eye syndrome, but they can also help with glaucoma, like we mentioned, but also just different inflammatory conditions. There are different inflammatory conditions you can get if you have autoimmune conditions and different things like that. It'll also help with any eye infections you can get. And there is also another drop that can now help treat presbyopia, which is just, getting a little bit older and needing reading glasses. So
Hmm.
there are drops for that now as well.
Wait, are you saying I wouldn't need my glasses anymore? That I could just I could just put some drops in and take my glasses off finally?
Well, it depends. It's really only for certain people, and there are side effects with the medicine.
Okay.
But yes, it is a prescription, and you can just go to your regular optometrist and ask them about it, and they can decide if it's good for you.
That's so cool. I love science, technology, medicine. It's just so amazing to me. And I've read the boxes when I've bought different eye drops, and not being an expert, I sort of feel like, well, it's probably not a good idea to use eye drops every day. And if you're using them every day, maybe there's something else going on. But from your expertise and your experience, is it okay to use them every day?
Yeah, it is. So I think the first thing is just to make sure you're using the right kind. And that would just be a discussion that you would have with your doctor and follow their direction on if they want you to use them every day. As long as you're basically following your doctor's advice, it is okay to use them every day as long as you're using the right kind appropriately.
Yeah. Yeah, that's such good advice. I've gotten in the habit of doing that. Or like when I took my cat to the vet the other day and we had been giving her some medicine that we'd had, I just, you know what? Rather than me trying to remember or describe what I'm taking or what the cat we're giving the cat, just bring things with me. And I'll
Yes.
just bring these drops and say, Doc, are these okay? Can I, am I allowed to take these every day? Right.
Yes, exactly. I always love it when my patients physically bring me in the drops or even take photos of their eye and was like, what happened? Because usually when by the time you get to the doctor, things are better. So I always
Yeah.
like it when they bring me in photos too.
Right. It's like, I swear they were super red yesterday, but of course they're not today. Right.
Right, exactly.
So, doctor, I know that the sun is not great for us. It may feel good and give us some vitamin D, but it's not great for our skin. And different podcasts would be about skin cancer and all of that. But generally speaking, is the sun bad for our eyes? And if so, would drops help?
So the sun, you did mention cancer. The sun can cause different cancers on the eye. About 5 to 10% of all skin cancers are on like your eyelids. So you can obviously get skin cancer growing around your eye. Eye drops don't help prevent any sort of sun damage. So it is important to always wear sunglasses to protect yourself from the UV light exposure. And you can be exposed to UV light whether it's a cloudy day or a sunny day. So, sun protection, sunglasses will help protect you from UV light, but UV light can penetrate the eye and cause the lens inside the eye to develop cataracts more quickly, specifically cortical cataracts. And it can also increase your risk of macular degeneration that causes permanent vision loss. And it will also cause premature aging around the eye, where it will cause the skin around the eye to thin out a little bit earlier.
Hmm.
And enhance your appearance of dark circles and eye bags and wrinkles.
Sure.
And you can even get sunburns on your eye itself. So it's always important to do sun protection, but unfortunately, eye drops don't help with that.
Yeah, so it's important to protect our skin, protect our eyes. Unfortunately, the eye drops, as you say, aren't going to help. But let's talk about contacts and eye drops. I've never worn contacts. It seems like a whole sort of laborious thing to me, despite how far they've come. But let's just talk about eye drops and contacts and how those things go together.
So you can use eye drops when you are wearing contacts. Eye drops that say they're preservative free, or they'll say on the box for contacts. They're safe to use with contacts. Some of the ones I personally like is Opti-Free Pure Moist. It'll say re-wetting drops. So Opti-Free also makes a contact lens solution. It's not the solution, it's the re-wetting drop. The reason why I like that one a lot is that it contains a buffer in it to help prevent protein buildup on your contact lenses. And they're really good for people who wear like a monthly contact or an extended wear contact, but it's only for soft contacts. So if you're a hard contact lens wearer, a gas permeable contact lens wearer, Blink drops for contacts are great for both hard and soft. And you can go ahead and put those in, and your eyes should feel a lot better when you're wearing contacts. Or if you're that uncomfortable, you can always talk to your doctor about switching contact lens brands or materials.
Sure. It does seem like there's lots of options out there.
There are.
Maybe too many, but let's not get into that, right?
Yeah.
So my experience has only been going to the local RX and just grabbing, eye drops that seem appropriate. Like I said, I take the allergy eye drops in the allergy months. Generally, what are your thoughts about over-the-counter eye drops? Are they safe?
So they are safe, but I wouldn't say they're created equally. So, for example, there's 3 different types of dry eye that people can have. You can be aqueous deficient, evaporative, or a mix between the two. And most people are mixed between the two. They're a combination of both. And all of those eye drops that you see, that's really overwhelming when you get to that eye care aisle at the
Yeah.
pharmacy.
Yeah.
Yeah, so you don't really know what kind, but they are all different. So some drops are geared more towards different kinds of dry eye than others are geared towards. So if you don't know, what kind of dry eye or which ones your doctor recommended for you, my favorites are like Systane Complete and Refresh Digital. And I do stay away from the generics. So the issue with the generics is the preservatives in them.
Okay.
So when you go to compare generic versus a name brand drop, the active ingredient will look the same. So you'll think it's fine, but it's the preservatives that they're switching around. So the most common preservative is BAK. And this can cause like nerve damage in the eye. It can cause like delayed wound healing. And a lot of people have a toxic reaction, and it causes ocular surface issues. So it actually makes your dryness worse with this preservative.
Right.
And the name brands, like the drops I just mentioned, they use a different preservative from BAK, but the generics usually like to use BAK as their preservative because it's cheaper.
Sure.
So they're generic, the active ingredient's the same, but the preservative could be BAK, and that can make your dryness worse.
Yeah. Yeah, it really does seem like when in doubt, rely on the expertise of your doctor, show them what you're taking, take pictures of your eyes so they can see how maybe your eyes reacted to things, and try to stay away from the generics. It's been really educational today. Just want to give you a chance as we wrap up here, just sort of overall thoughts about eye drops and when, how, why, all that good stuff.
Yeah. Well, I mean, I love over-the-counter eye drops. I think it's great that we have like so many available to us, but it can definitely become overwhelming. So
Yeah.
I think just try to stay away from the generics and ask your doctor which kind specifically and which brand is best for you, because there are so many different eye conditions that they're geared towards. But they are safe to use every day as long as you're following your doctor's instructions.
Well, that's perfect, Doctor. Thanks so much for your time today. You stay well.
Yeah, thank you. You as well.
For more information and other podcasts just like this one, head on over to prismahealth.org/flourish. This has been Flourish, a podcast brought to you by Prisma Health. I'm Scott Webb. Stay well.